Well, I know what happened to your brother. I'm very sorry. Very sorry to hear that. I read about it, and it's a tragedy.
Well, I'm here to fight so that nobody else has to go through what our family's going through right now. I want to fight for Christmases that have family members and no empty chairs. My brother had his first heart attack when he was 39. He needed a defibrillator because he had a sudden death arrhythmia. All the years that he had insurance from his job, he was able to care for his defibrillator and his heart. Not a problem, except he paid $25,000 for costs that the insurance didn't pay. When he lost his job in 2003, he lost his health care, and what we found out, he lost every chance he had of getting quality medical care. And in 2007, he collapsed at work, and that was on December 14th, was taken to the hospital, was put on a 23-hour monitor bed. The doctor came in and said, your defibrillator is extremely low. He said, you're really lucky that it fired this time, and sent him home and said, come back as an outpatient once you have the money. Needless to say, he wasn't going to have the money. So he was working then as a pizza delivery driver, and on March 7th, he came home. He was coming home from work, drove 2 blocks, came to a stop sign, put his car in park, and slumped against the steering wheel. On the chart, it says that the paramedics treated him for BFib, for his arrhythmia, and that there was no juice left in his battery to convert it. Now, he was 57 years old. It's not just our family, but friends and acquaintances and a little boy and an elderly woman. If the doctor had seen his gentle soul, trust me, he would have fixed his loving heart. But he didn't, and he didn't. So we need to stop this, Senators. It's just bigger. People are scared that they're going to die because they have no medical care. And some have cancer, and some are diabetics, some have lupus, some have a lump in their groin that they're hoping is a hernia, but no doctor will see that. And one woman lost her husband, and she said to me, after he had stopped at a doctor's office, but they refused to see him, and she said to me, I feel bad that he died, but I feel awful that he felt he was worthless from one trip to the doctor's office. So that has to stop. We really need to stop. And if you can come up with a plan without a public option that you in your heart of hearts can say, this will help the American people and not just the insurance company, then you've got my vote.
As you know, it's in the newspapers all the time about one senator after another objecting, stopping us from getting 60 votes. And some people are saying we ought to do nothing. And the point I made is that there are a lot of good points, not what I like. I like a public option. I like a robust public option. I've spoken about it. But it took a long time to get the Civil Rights Act. They passed the Civil Rights Act in 1965, but they passed one in 1957, which wasn't so hot. But it was a start. And they passed another one in 1964, which was better. Then in 1965, they got a real act. And I've talked to former Governor Howard Dean about this. He's a very major activist. And he's out with an article in the paper today saying we ought to throw it out and start again. And much as I like Howard Dean and respect him, I don't agree with that. He does say in his article that the Senate, Democrats in the Senate ought to try to make it better. What happens, it's all very involved, but the House has passed a bill. Now the Senate is considering a bill. If the Senate passes a bill too, then there's a conference. If the Senate doesn't pass a bill, there's no conference. And if there's a conference, it could be improved. Does many things, does not do everything I would like. It does eliminate insurance rejection on pre-existing conditions. It cannot do that. So if your brother applied for insurance and he had a pre-existing condition, he would, they could not reject it. And
Can they charge him a lot more, so in the sense,
What's that?
can they charge him a lot more than their other customers
No,
so that he,
No.
in a sense,
There's a contention
steps
about
back?
charging more for elderly, and the plan covers 33 million more Americans. It does that. And it provides for annual exams at no extra cost. So you can catch a lot of illnesses which could become chronic, very disabling, very expensive. And anybody else have a comment?
A little concerned, because I think part of the power of the public option concept is that, you have that automatic system in place for accountability for the insurance companies. I'm concerned with the insurance companies having so much power in politics, the ability to undo regulations, while folks aren't looking. For instance, with the financial meltdown, there were regulations in place for Wall Street that they managed to dismantle over time.
For Wall Street?
Yeah, just as an example, they were able to dismantle that system of regulation. So I think that's why so many people are so adamant and concerned that there is public options. So there's that piece in place that is a mechanism for accountability that isn't so easily taken apart.
I agree with that. The insurance rates went up tremendously for small business, and the report was, I talked about this on the Senate floor, that Wall Street was pressing the insurance companies for bigger profits before the government plan came in. We had a hearing. They have less power than you think in terms of influencing Congress. It is true that if you go to fundraisers, you have access. You can talk. There's no doubt about it. I'm in Pittsburgh all the time. I'm in Pittsburgh every few weeks for the last 30 years. 33 years, since 1976, the first ran for the Senate against John Hahn. Goes back a long time. And we had a big fight about reimportation of drugs. Insurance companies don't like it. And I voted for it. Bring drugs in, if they want to bring them in from Canada, bring them in from Canada. There was an addendum, they have to be safe. Can't bring in drugs that aren't safe, no matter how inexpensive. But we fight the insurance companies. We really do. Most people are concerned about doing the right thing. I mean, it's a political battle. The fact is, on the Senate floor today, I said it was a blood sport. Blood sport. Republicans want to beat Obama. They want this to break. They want this to be his water. Well, we're fighting it out.